You are listening to the Doing Motherhood podcast, where we talk all things Black mothers today. Hello, listener friends. How's it going today? So today we have a lot to talk about. We have Raven Dorsey back again. Don't y'all love her? I just love her. So we have Raven Dorsey back with our issues in the news. We have a lot to cover. So I'm really excited about what we need to talk about then. And then in our 411 segment, I am going to be having a more in-depth conversation about empty nest syndrome, what it looks like, who's affected. Just want to dig a little bit deeper than what I did last week. So hang out with me, we'll get into it. But before we get started, I want to remind you that the Doing Motherhood podcast is now looking for sponsors. And so if you are a business owner and you have products or services that you would like to advertise on the Doing Motherhood podcast, we have a listenership of listener friends who are mostly Black women, Black mothers, those who identify as women, who are, they're also business owners, they're moms, they're professionals, they're athletes, we've got everybody. So if you would like to advertise your products, your services, take a look in the notes. I have a link for you to send an email, and in the subject, you will put DMP sponsors. All right, let's get into it. Hey, Raven, how you doing?
Hi, Anya. How are you?
I'm good. How are you?
I am good. We have a lot to get through today.
What is going on in the news?
A lot. So let's start with the good, exciting news, which is that last week, Judge Brown-Jackson was confirmed and will be our next Supreme Court justice. Woo! Very exciting.
I'm
Yes, all the things. She was confirmed as planned on April 7th and is now set to be sworn in late June, early July. She received 3 Republican votes, which is very significant considering how at odds our federal legislative system is. And I think it was just a really exciting, really wonderful, show-stopping moment. And I'm curious to hear if you have any thoughts about the official confirmation.
Well, for one, I never really was concerned that she would not be confirmed. I think one of the things that, again, going to the last conversation we had about it is the, I don't know that it's backlash, but the, what is the word I'm looking for? Like the vitriol she faced, right?
Yeah.
But one of the things that I think that is not or has not been taken into account by those who oppose her is her actual record and the fact that she is the most qualified justice that will be sitting once she is sworn in, that will be sitting on the Supreme Court. And I think it just speaks to, again, how Black women are perceived. I like to take things that we see happening in the media and in politics and all of that and bring it to real life. Yeah. And it's an ongoing battle. So she barely won, even though she's the most qualified person that we've seen in some time. And for me, it's just that much more vigor that I have to keep going at the goals that I have, right? And I hope that other Black women and Black mothers are watching this play out. It's not fair. It's crazy. It's stupid. Right? We can acknowledge those things and still realize that when it's for us, when we do the work, when we apply ourselves, when we keep going and fight through it, victory is always in the end, and it's ours.
Absolutely. And I think what you're also talking about speaks to how polarized we are as a country. It's like even her vote count, like the amount of votes she got from the opposite party, like fall beyond what Thurgood Marshall received or Sandra Day O'Connor, both like historic nominations. And I think that speaks to how like far removed we've gotten from common sense and how polarized we are as a country.
I think too, yeah, I absolutely agree with it, that what we're witnessing has more to do with race relations, the social commentary that's happening right now, and very little to do with her and who she is as a person, as a professional, as a justice, all of that. Absolutely.
Absolutely. And as we talk about how polarized and where we are as a country, the next story that I had to share with you was about the Oklahoma abortion ban, which is like, you know, can't even. But as many of our listener friends probably know, legislators in Oklahoma passed a bill on Tuesday that would make performing an abortion illegal in the state, except to save the life of a pregnant person in a medical emergency. This piece of legislation does not exclude for rape or incest, which I think is really important here. The bill, SB 6612, would make performing an abortion or attempting to perform a procedure a felony punishable by a maximum of $100,000 or a maximum 10 years in state prison, or both. It's just insane. And unfortunately, Governor Stitt, who previously promised to sign every bill limiting abortion that came across his desk, has also promised to sign this bill. Under the bill, the birthing person would not be criminally charged or convicted for the death of their unborn child. However, the measure would not prohibit the use or sale or prescription of contraceptives. So like there are just some notes here about like how archaic this bill is, but also there are some things here that are a little bit different than some of the bills that we've seen, say, out of Texas. However, as far as what's next, we will look for the governor to in fact sign this bill. And we will also, the Oklahoma Senate as well is also considering House Bill 4327, which is modeled after the Texas law that allows enforcement through private civil lawsuits, which is the thing that was so like scary and alarming about the Texas bill, is that it then empowers like regular citizens to then like go after people who are looking to get reproductive health care. And so if the Oklahoma bill goes into law, it will absolutely receive legal challenge. However, if Roe is overturned this summer after the Mississippi case, it would ultimately make room for laws like this to stand, which is like really scary, but a very real reality that we are experiencing. And so as far as what this means, I think we all intuitively know what this means, is that like, you know, our right to make decisions for our own bodies is being challenged. And I feel like the doors are closing in a little bit. But this means that we're going to be looking really closely to what happens in the Mississippi case this summer, fall, and that will most certainly set the tone for how laws like this will be received and ultimately if they can be challenged.
You know, last week we learned here in Texas that there has been a woman who was brought up on charges for performing a self-abortion. If I understand correctly, I don't have this confirmed, but it was a nurse or a healthcare provider who made the report. So now in Texas, we're seeing this play out where, you know, a woman was brought in under trial and charged with murder. Now those charges have been dropped. And so there is some back and forth that is now going to happen. But like you said, like we're seeing that challenge, it's playing out in real time. And so it's starting to get a little bit scary. One of the things, or what is that show, Handmaid's Tale? Everybody was like, oh, and when I first started watching that, I was like, I can't watch this. This is real life. It's about to happen. They're trying to make it happen. I just want to remind our listener friends that I did share an episode previously, and I'll put that link down in the show notes to the title of it is Texas is Wildin, and now Oklahoma has joined Texas. But I share some really good information where people can find resources to take care of themselves out of state if that's what they need to do.
Yes, and then that's ultimately what we're going to see happen, is that the states that do have abortion access are going to be like overrun and going to need a lot more capacity to help serve the folks who are coming from out of state. That's ultimately what we see happen. We never see abortion decrease, we see it increase, and we see it ultimately become more dangerous in some scenarios.
Yeah.
So we'll also have to keep an eye on that. And then our last story, in the vein of it being Black Maternal Health Week, is a really interesting update on a new initiative in New York, which was a 3-part plan announced by the mayor on March 23rd, with a plan to reduce maternal health inequities. And so it's a 3-part plan. The first one being the midwifery initiative, which is focused on building out existing research on midwifery care models across like pregnancy, birth, and postpartum outcomes. And the expansion of this initiative to include like a steering committee, conducting research with NYU, and basically creating a tool to like measure the impact of midwifery care. Mm-hmm. The second piece is what's called the Maternity Hospital Quality Improvement Network, which will allow the Department of New York City Health Department and mental hygiene for the first time to gather data on births and care with midwives. So once again, creating like data and research to back up how midwifery care positively impacts health outcomes. It does include some training for staff in racial equity, implicit bias, and trauma-informed care. And there's not a ton of information on exactly what that training looks like at this time, but of course, as I get more information, I'll bring it back to share with all of you listener friends out there. And then the last piece is the citywide doula initiative, which aims to train about 50 doulas and reach about 500 families by the end of June. Families who enroll in the program will receive a doula both at home and in the clinical setting, with 3 prenatal home care visits, support during labor and delivery, and 4 postpartum visits. And clients who give birth at home will receive the same number of visits. The program will include providing doulas to eligible residents that's determined by like a task force on racial equity and inclusion through the city. So these areas that the target population is going to be pre-identified. And then doulas will be assigned to clients through local partners, some of which are like doula and friends and advocates who have been doing the work in the city for a long time. What this means generally is that money is being invested in maternal health, which I think is really important to note. I've said before that like sometimes how institutions spend their money is how they basically say their priorities, right? Like you put your money where your priorities are and where your time is. Mm-hmm. And about $30 million is potentially being invested in this project, which I think is really interesting and really important to note. I'll also note and explain what this means, that one of the goals of the project is to certify doulas. And you and I, Anya, have talked a little bit about what this could potentially mean for doulas as a whole. But the idea seems to be, from my analysis, is that the goal is to certify doulas with the idea that to set the pace for potential insurance coverage for doulas in the future. The program is planning to support newly trained doulas, but those who are uncertified in getting certified through this program.
Okay.
Also working with, as far as I know, local organizations who also are certifying organizations versus sending them out to larger certifying bodies.
Yeah.
That is my understanding. And of course, I'll update you guys if I hear any different.
I'm so sorry.
Yes. And the last thing, which I think is going to probably get to what I think you might say, is that doula pay will be standardized as well, which is about $750 for doulas who have supported less than 10 births, and $1,500 for those who are certified doulas who have attended 10 or more. And so that's basically, what the program looks like. However, there are always things that I think we will watch, and this kind of goes along with what this means. Is it possible, and from a policy perspective, to train 50 doulas to serve 500 clients in just 3 months? Is that logistically possible? I think you and I both know that a caseload of maybe 4 clients a month on your own is like a lot. And I'm curious to hear what you think about this. But also, will doulas be placed with will there be a good client and doula match system that allows clients to be matched with folks that they feel comfortable with and can feel fully supported by, that understand their experience? And also, will this program potentially lead to increased regulation of the doula profession? And so those are some things I think we need to look at, but I'm so curious, Anya, to hear what you think.
I have so much to say. So first is, I'm really happy to see that action is being taken. This is a conversation that has been going on for years. And from my perspective as a doula, as someone who is in the trenches, I feel like we've been doing a lot of talking, and not seeing much actually take place. So happy to see that this is taking place. I'm actually really happy to see that, they have a start point of June, that they want these doulas trained. One of the things that brings me, going back to their research on midwifery, I'm just like, the research is out there. We don't need to perform more research. Just go look at what's already been done, right? We have Jenny Jones in Florida, midwife who has improved the maternal health outcomes of those families who are taken care of in her care, in her community. I don't know, tenfold, right? So we know it happens, but I am happy to see that part of the initiative and part of what they're looking at is realizing that the midwifery model of care is what is changing those outcomes. And so I think if health institutions, if the MIC is finally going to start looking at how the midwifery model of care is bringing us to better maternal health outcomes than the standard healthcare institutional practices, then wonderful, we're on the right track. In terms of doulas being trained by June, listen, New York City has had the highest number of maternal deaths, Black maternal deaths, out of anywhere, where most of the country sits around 3 to 4% of Black women, or Black women being 3 to 4 times more likely to die. In New York City, that's been as high as 12%. 12 times more likely, excuse me. And so emergency, I'm happy to see. And yes, most doula trainings happen over a weekend. Get them in, get them out. I'm also really happy to see that they are partnering with community organizations that are already established, that the community trusts, because evidence has shown us that they can't be hospital programs. It can't be more people from the hospital if the community doesn't trust hospitals and professionals from the hospitals, and who they trust to take care of them are people in the community. So good job to New York on that. The one thing that I'm like, is this pay?
No.
Because
it's a no.
doulas need to be paid. Like you brought up, a client load of 4, if you're seeing them 3 times for prenatal care in the beginning, that's like 90 minutes to 2 hours most times that doulas are spending. So like 2 hours 3 times, and then 4 postpartum. Like when you bring in that labor averages, you're there for an average of 10 to 12 hours.
Yeah.
Like you break all those hours down, like people are getting paid like $10 an hour.
Yeah. And that's not even a factor. If you're working with first-time moms, like we're talking the labor could be significantly longer, or you're going over to the house first to help labor because this is the first time. Like there's like so much, time and effort that goes into it.
So I think there needs to be some, and hopefully that's something that they're going to be getting feedback about, and really listening to the doulas who are doing this, because that's not a livable wage. And if we're expecting people to take care of an amount of clients that is full-time work for them, then we need to make sure they're getting paid a livable wage. $750 per client in New York City? No, not.
Yeah.
Now, I understand that that's for those who are not certified, and that those who do become certified under this program will, $1,500 is a little more like it. In New York City, I know $1,500 is kind of the going rate here in Houston.
Yeah.
So I imagine in New York City, it needs be a little bit more, but I think it's a good, I think it's a really good, solid start. And I'm happy to see this. And I will be happy to see that, cities across the nation are going to start matching it.
Absolutely. And I think the last thing I'll do before I hop off is also share that one of our, I think, mutual friends and partners at the Bridge Directory has actually been kind of creating this work themselves. And so I just want to shout out local organizations that have been recreating the work for themselves in the community, by them, for folks in their communities. The Bridge Directory has been basically creating a group of folks who like providers and basically connecting local folks who need those services with these providers who are culturally competent and willing to provide care at different rates for accessibility purposes. So just want to shout them out as well. But I think this is something that we're gonna be keeping a close eye on. I'm really curious to see how it works and how it plays out. And we'll definitely circle back with more information about this story in particular.
Yeah, that's awesome. Well, Raven, I appreciate you.
I appreciate you too. And thanks, listener friends. And we'll certainly be back with more stories in 2 weeks.
And just remind them where they can find you, Raven.
Oh, yes. You can find me on Instagram at Raven M. Dorsey. And stay tuned on my Instagram for a bonus story that I think y'all will all find really interesting.
All right, we are back with today's 411 segment. And in the 411 today, I am taking a deeper dive into empty nest syndrome. But before we get into that, I want to remind you how you can support the podcast. You can support the podcast by listening and subscribing in the places that you listen to the podcast most. So we are on all major podcasting platforms: Apple Podcasts, Google Podcasts, Spotify, iHeartRadio. So if you're listening there, please subscribe. Also, leave us some reviews, some comments, give me some feedback. You feeling it? You not feeling it? What do you want to hear? I want to hear from you. I would also appreciate if you're watching on YouTube as well, because we're there. So I'd love for you to join us. Share it with your folks, share it throughout your network with other mothers, with, your friends, your family, your work network, all of that. And also follow us on social media. You can follow us at doing_motherhood_podcast on Instagram, or you can follow us on YouTube, Doing Motherhood Podcast. And we want to hear from you there. So I want to, leave your comments. Let's engage in the comment section. I'm looking forward to having those conversations with y'all. All right, so let's get into it. Like Raven said in the beginning, in our first segment, our issues in the news, this is Black Maternal Health Week. And I typically do a lot for Black Maternal Health Week. Like I'm on people's conversations, their podcasts, the past few years, like I've been invited on podcasts to talk. There have been events, that are here in the city that I've shown up for. But let me tell y'all, this year, I feel like it kind of snuck up on me. It's the same time every year, y'all, but I feel like it snuck up on me. I didn't have any plans. And so much of that is because of what I talked to y'all about last time, this, finding myself in this period of empty nest syndrome and just not being able to be outside of myself right now, aside from exactly what I have to do. So I got to keep my household running. So I got to show up for work and I have to, take care of things for myself and for my son. But I want to say, most of the time when we're talking about Black maternal health, we're talking about it from the aspect of pregnancy and childbirth and the postpartum period and how women are being taken care of in the villages that are around us and, what's happening in the medical world, what's happening in out of hospital birth situations. That conversation is there. But I also just want to remind us that we're mothers forever after. And so this is a little bit of a twist on the conversation. It's looking at it from the other end of the spectrum, which is this, the side that I'm in right now for myself. And so this is my small contribution anyway to the Black maternal health conversation. I was also on a podcast. I was a guest on another podcast. So look out for that. I'll share that information as well. So anyhow, empty nest syndrome. Today, I want to talk about what that is, how it's defined by mental health professionals, the mental health experts. I've done some digging because like I told y'all last time, I didn't even realize this was a syndrome. I saw empty nest my kids are grown, they getting out the house. I'm going to do my thing, right? I'm a single mom, I'm a divorced mother. And so for me, I was looking forward to this as all right, this is my time to shine. This is my time to only focus on myself. So I had a lot of positive energy, positive imagery about what this time period was going to look for. And it caught me off guard when all this other stuff kicked in. So we're going to start with our questions. Who, what, when, and how. I don't have the where. The where is at your house. But I have the who, what, when, where, or the who, what, when, and how. And then we're going to talk about the needs that parents who are facing this, what they need to do to take care of themselves. So what empty nest syndrome is, let's start with the what. So empty nest syndrome refers to the distress and other complicated emotions that parents often experience when their children leave home. And so that definition came from Psychology Today. And like I said, it's a syndrome because it can take over, right? It significantly changes the feelings that you're having, those emotions, the complicated feelings. They tend to change what your daily life looks like as the parent who's experiencing that. So like I told y'all last time, there was a period of 3 weeks where I literally, I had a couple of births I had to attend. So I went to those births. And then of course, I see clients for their prenatal visits and I see people for their postpartum visits. And so I went out and I made the visits that needed to happen. I had What else just happened? I had for Hospital Doula Training Co. We had our in-person training over the weekend, a week ago, 2 weeks ago, maybe. And so like I had to show up for that, but it was so much effort. There was a period of 3 weeks where I just was in the bed or on my couch, where it felt like I could not do a thing. And what was crazy about it is that I didn't really understand what was going on. Like I knew that these were feelings that I normally associate with depression. And so it is depression, but it's the syndrome that brought me into like that type of state. So I don't know if that makes sense, but because one of the things that the experts say is that empty nest syndrome is not like, there's no diagnosis for that. So it is not seen by, mental health professionals or healthcare professionals as a diagnosable category, right? It doesn't fall into, so no one's going to diagnose you with empty nest syndrome. What they're going to say is you're experiencing grief because of empty nest syndrome, or you're experiencing depression because of empty nest syndrome. And so it's not going to be its own diagnosis, but it's very real. It's very real. And people are affected by it. I remember when Bryce and I went to his college, we went to the college visit out in Denver, and I was speaking to this couple of parents of one of the other soccer players, and they're amazing. But they were telling me, so they have two older children, and then there's the player who is going to be Bryce's teammate. And so what they were telling me is that their older children had left and things were great. They were like wonderful. But when this youngest one, he's not in college yet, but he went away for a soccer training, similar to like the academy that Bryce is in. And they said they started feeling it when he went away to the academy. And they were like, we were just like walking around the house crying all the time. They're like, they just like sitting around watching television or whatever, and they just look at each other and burst into tears. And so it's a very real, I want people to take away from this that like, it is real. The syndrome is real. The feelings it puts you in is very real. But if you go to your therapist about it, or you go to your doctor about it, they're not going to diagnose you with empty nest syndrome. They'll probably, like my therapist told me, you are grieving. And I was like, I know. But why? Right? And so that's that. So who's affected? Of course, all parents are affected by empty nest syndrome, or they can be affected. Not everyone is, some people, they're looking forward to what the empty nest brings them, right? But some of us struggle with that a little bit, and we have to kind of get ourselves through those feelings. I'm particularly interested in speaking to Black mothers, and especially those of us who are single mothers or divorced mothers, or not even just mothers, like parents, right? So if you're a dad listening to this, but if you have been the single parent in your household, I want you to think about how even more, like it compounds more issues on top of it, right? So yes, there is absolutely that feeling of grief, or, maybe some depression feelings, or maybe just angst about the huge change that's coming, or, some anxiety about all the changes. But a lot of what I'm reading is that these feelings are coming because it is, one, a sense of loss that we're experiencing. Anytime we have some major life change, right? We're losing some part of ourselves as we move forward into the future, into what our future selves are going to be experiencing. And that change, just like divorce, just like marriage, just like a new baby coming, just like, a parent passing away, or someone very significant in your life passes away, we experience loss in all of those areas of life. And so empty nest syndrome is no different. Like, it's a sense of loss when your entire life changes because your children are moving on to their own lives, and we're happy for them, right? We're excited for them. We're proud of them. But it's a sense of loss for us because now we're not doing those same day-to-day things. Now, when you think about a parent who is a single parent, where a married couple, oftentimes their relationship is the primary relationship, right? The marriage is the primary relationship for them. And for those of us who are single parents, the relationship that we have with our children is the primary relationship. And so where those couples are able to turn into one another and have each other, right, to work through this with, Black mothers, Black single parents, we often don't have that other person. And so we have to get really creative, and we have to be very intentional about who else we bring around to help us get through this. In addition to that, right? Just like, who's going to be by my side? Who is my trusted person, or who are my trusted people to help me kind of deal with these feelings? Or, I think too, we not even saying that people have to help us deal with the feelings, but like, just to be there. Like, who's coming to sit on this couch with me? Who's going to be up, answering my phone calls or sending me text messages, or just send me some memes, y'all, please. Send me the memes. Like, I just want to laugh at stuff. Really, seriously. I'm like, I just want to laugh at things, right? But who are the people that you can trust that are going to show up and be there when you find yourselves in that time? The other thing are some of the compounded issues, especially for Black parents, because yes, I'm dealing with the sense of loss that my house is now going to be that much more empty, because now it's not just one son that's gone away, but my second son is going to go away. But I'm also thinking about like him and where he's going. And so for those of us with Black children, the social, like, think about the state of our society right now, especially when we're talking in regards to race, right? And so I'm thinking about myself, and I'm so sad, but I'm also thinking about, like, he's going to Denver. He's going to the University of Denver. That is a white school. Like, when I went to visit that weekend, I was counting Black children, Black Black young adults. I was like, oh, okay, I see 6. There go his folks, right? And again, not to say that I'm worried that he's gonna have an especially hard time in Denver, or that the people there are not, I've met the team, met the coaches, met all of the folks who are going to play a part in his life during this time. But I also am trying to be realistic, and like, my child is going to be one of few Black people where he's going. I think about the stories that I've been seeing in the news where, like, young Black men or young Black women who are outside learning themselves, learning the people that they're with, that they go out, they have a group of friends, and somehow everyone comes back except for the Black child, right? Those are things that are playing in my mind. I saw a news report a couple of, I think earlier this week, about police in Denver targeting Black people, right? So like, those are very real issues that I have to think about, on top of the fact that my child is leaving. So I'm really, again, like I said, this is a conversation I want to keep having. And this is a conversation that, for those of us who are single parents, who are Black single parents, there's a lot more that plays into what we have to think about and like where some of these feelings are coming from, right? I'm not afraid. I'm experiencing a sense of loss for what's happening in my household. There is also some anticipatory anxiety about the environment that my son is going to. Where's the big win? So a lot of people experience these feelings when the child leaves. So there's the whole, right? I have this whole picture of us packing up the car. Bryce wants to drive to Denver. So we're going to drive up there. And I'm just anticipating like helping him put his dorm room together and then having to get back in my car and drive away. And so that already, like I thought I was prepared for that for August, but like I told you all, I was not ready for the fact that these feelings have already started and that they were already in play. And also just, you know, in my own personal situation, I'm looking at the timing of it because in December, I spent time with Jahari, my oldest son, for the holidays. And so I was with him. We had a wonderful time over the holidays. But then I came home to an empty house and the realization had set in that he is a full grown adult at this point. He is a man who stands on his own 2 feet. He is well into his profession. He's doing a great job. He's got his own place. You know, like he's got all of the things that like, I think sometimes as we're just living day to day as parents, if you're not keeping track, your kid is still your kid, right? That's why I still refer to them as my kid, because it's just like, all right, kid, we've been doing this thing for so long and you're my kid. And there is a point where you have to, the realization sets in like, this is an adult that I'm speaking to now. And our relationship has to change. So I came home for the holidays, from the holidays with that realization, and then the realization of Bryce leaving started to set in. And not just the realization, but things that I started preparing, right? Like having to take care of financial aid stuff and having to show up for meetings for his college and his soccer team and all of that stuff. And so it's just like one thing and then another thing and then another thing and another thing. And so I just want people to think about the fact that like, it's not just about you dropping them off at college, that some of this might start ahead of time. And it wasn't until I was like in the throes of it. And then I reached out to my therapist because I was like, ooh, I gotta get back to it. I need some help. Like this is no longer like, you know, moodiness. Like this is a thing that I need help for and to figure out how to get myself through. And she said it off top. She was like, you're grieving this next step. You're grieving the loss of your sons as your boys and realizing that they're men. And it's going to take you some time to work through that. How does empty nest syndrome show up? So a lot of times it shows up as sadness. I told y'all in the last episode, I'm weepy all the time. And when I say weepy all the time, I mean, I be in the car weeping. I get in the kitchen to start cooking dinner and I just start crying. I think last night I was sitting on the couch and Bryce was in there. We were watching television and I had a memory of something that we used to watch together. And I know he is probably like, I wish she would. Like, I wish she would get herself together. I don't know. I don't even know if he notices. But yeah, it's just this immense sense of sadness, feeling loss, feeling depression. So like I said, for 3 solid weeks, the only time I got out of bed was to go see clients and then I'd come back and get right back in my bed. I walked around with my depression sweater on. I have a sweater that is like designated as my depression sweater. When I wear it around my house a lot, but I don't ever wear it outside unless I feel depressed, because it helps me feel like I'm still in my house if I'm wearing, and that's where I want to be. So depression is real. Loneliness, again, going back to those of us who are single parents, that loneliness can be really real if you don't have a partner that you can turn to, or a really good trusted friend or confidant that you can turn to. Distress, worry, or anxiety over your child's well-being. Like I said, thinking about, one, just like, what's his life going to be like when he gets there? Like, is he going to be okay? Is he going to be experiencing homesickness, right? But then for those of us who are Black parents, there's a whole other host of things we have to think about when we're not seeing our children on a daily basis, and we don't have, like, we can't put tabs on them most of the time. And we can, I tell Bryce all the time, when you leave this house, you need to have ID on you, because if anything happens, people need to be able to contact me and like know who you are. Well, I'm not going to be there. I'm not going to be in Denver every day to remind him to carry his ID, right? And that it doesn't matter if he's only going to the corner store, he better have it. He's going to do what he does. And so those are very real, like, worrisome issues that parents might be thinking about. This loss of purpose and meaning in life. And so when, Jahari is 26, this summer he'll be 27. Bryce is 18, this summer he'll be 19. For the last 26, 27 years, every day that I got up was getting up to make sure that I could take care of them, and that everything that they need to have in place, that, that I was looking for the opportunities for them to do what they want to do and live their dreams. And of course I get up for myself, but I think that, it's just not something that I really had to think about, or that it's natural, right? Like, you get up and you do for your household, you get up and you do for your children, you get up and you do for your family. Again, I became a parent when I was a teenager. And so that has been my life. Like, I get up and do things because I have children that I have to take care of. And now, for the first time, I'm coming to the realization that, like, that's been my motivation for their entire life. I have not really thought about, I had dreams and I had goals and I've set out and done those things. But, a couple of weeks ago, I was at home and I was just like, if he's gone, I really don't have to get up. So yeah, just these thoughts of like, am I going to get up for me the way that I've gotten up for them, right? And of course, I don't have a choice. And I will. But figuring out what that looks like, and figuring out, like, the new motivation, and figuring out a purpose within myself that is not driven by having to do for those who have been depending on me for their entire lives. I think that's the place for me, in this list of, the way that it has shown up. Like, that is the hardest part for me, is just like, what does that look like, right? What does it look like to wake up in the morning and not have to think about Bryce's schedule intertwined in my schedule? What does it look like to wake up on a Saturday morning and not have soccer be the primary thing that we do? Or when Jahari was home,
and we would travel all the time, or we used to like have like weekend adventures. And so yeah, it's just this it's this change in like, what is the meaning of my life and what is my own purpose for myself. That is, I think that's where like my grief and my depression is setting in, because I can't see it. And yeah, there's just, work. And like I said, I gotta get back. That's on the top of the list for my next therapy session. That's the first place I have to go. For those who are married, some people, they're able to turn to each other and be each other's rock and help each other get through that, right? But for other couples, that might be where they start to find some marital tensions. Like that might be where they start realizing our only goal, our only commonality was these kids. And now that these children is gone, I don't even know that I need you to be here no more. Now, I don't know if that's the real conversation, but like that's real. Again, anytime there's a sense of loss, people start seeing themselves as different people and feeling themselves as different people. And that also changes the relationships that are around us. And so those of you who are married might also start realizing like, we got to tighten up. Like we have to get stronger. We have to find a way to bond with one another through this time so that we make it through. Or people might realize like, I don't know. But, so those are the things that's how it shows up. That's how empty nest shows up for most people. So for those, if you're like me and you're really struggling through these feelings and you're really struggling through loss, if you're realizing that the feelings that you're having or the emotional turmoil that you're experiencing is affecting your day-to-day, it's time to reach out for help, right? It's time to reach out for counsel from a therapist, or those of you who are professional or you work in professional environments, if your job has an EAP program, an employee assistance program, start there if you don't already have your own therapist, and they'll help you get through, right? It's kind of just like get yourself a little jump start and see what you can work through. Because it can't, like, you still have to continue, right? We have to move forward. And not only do we have to move forward, but we get to move forward. And that's where I'm at right now, is just trying to flip it so that I'm not like caught in the despair of my own emotions. But realizing, getting back to that positive imagery and the positive attitude I had about what empty nesting is going to look like for me, right? So what connections do I need to make with people? We're coming out of 2 years of a pandemic where we have been mostly isolated from our normal networks. And so I've got to start getting back into connection. Like I've got to start getting outside of my house. I've got to start like finding events and things to go to that are going to become a part of my new normal life. Figuring out a new identity. Like I said, if my purpose for the last 26, 27 years has been get up for these kids, like, okay, now who am I getting up for? Me. Well, what does the new me look like? Right? What does me without having to drag children here, there, and everywhere look like? And what does she get up for? Right? What does she do? So that's looking for new hobbies. Maybe it's realizing that you don't even like the career that you've been in, but that's what's been providing the most stability for you and your children. That's what's been providing you the most security for your household. But now, girl, it's new, right? You get to choose for you now. Maybe that looks like a new location. Do you have to stay where you are? If you're not happy with where you are, why not get up and move somewhere else? Now, don't be following your children to college, okay? every now and again, I'm like, I mean, Denver is a cute little city. But I don't need to follow Bryce to Denver, right? But maybe that looks like in Houston. Y'all know Houston is huge, right? Maybe that looks like I live on a side of town that we haven't lived on yet. Maybe that looks like, I've been living between like single family homes and apartments over the last 15 years that I've been in this city. Maybe now that looks like me moving into a high-rise apartment building and, doing whatever single people do in high-rise apartment buildings. Maybe it looks like setting a plan to move to another city in a year or two or whatever. I play around with the idea of becoming an expat all day, every day. And so maybe it looks like that at some point in time, right? So just really looking at like trying to flip the narrative for yourself about, instead of looking at only the loss and focusing on how much is changing and dreading it or wishing it weren't happening, or, I knew it was coming, but I didn't think it was coming this soon. Yes, that's real. But realizing who you get to become, right? Learning a new you, learning new things, seeing new people, meeting new people, learning, getting into a new career path, like all of that it's a grand opportunity for self. And also really getting into, and I'm going back to my single mamas because sis, but like really doing, I've stopped saying self-care because I feel like self-care has become very superficial. I feel like self-care is we're running it in the ground, okay? But I'm trying to think of it now as soul care. What do I have to do to take care of my soul, right? So that I don't get stuck in those hard feelings and emotions in places. What do I have to do to take care of my soul so that I can be my lightest self, so that I can be my highest self, right? So that I can become or do more than I have been doing for this time that I've been a parent, right? To these two. So that's the deep dive. That's the deep dive into what empty nest syndrome is, who it affects, when does it hit us, what does it look like, right? How does it show up in our lives? And what are the things we need to do to keep pushing forward and not get stuck in that place? And I say that to say also, like, take your time in it. Take your time. You don't have to rush it. I think part of what I was trying to do was like, okay, I'll give myself 2 weeks and then I need to get on with life because, stuff is real. I have stuff to do. So I can't be stuck in my feelings. But my past experiences have shown me that when I try to rush myself through these processes, I only elongate the process and it ends up worse than it has to be. So taking your time and doing the work, but not getting stuck in that one place, right? Take your time and just small steps, baby steps forward until you're smiling again, you're shining again, you feeling yourself again. Okay, I had to put on my favorite red lipstick today, right? I had to put my crown on my head today so that I can show up and feel good. And I'm doing that for myself more than I'm doing for anybody else. And so that's what I am leaving you with today. I hope that this is helpful. Please let me know. Let me know if you want to hear more about this. Like I said, this is going to be Empty Nest Chronicles, so y'all going to hear about it. We won't talk about it every time, but we're going to hear about it. But I'm going to you know, like I'm gonna walk the walk and I'm gonna talk the talk. And so you're gonna see me out in them streets. When I get out in the streets, you're going to see, you know, some I'm working through it right now. So I don't have a full plan. And I'm okay with not knowing for the moment what exactly that's gonna look like. But you know, follow me. Like follow me through that. I want to, I don't know. I'm going to explore it and I hope that you enjoy the exploration with me. So that is that for today. Um, Again, go follow us, subscribe, like, listen, share, leave us some reviews and some comments. If you are interested in being a sponsor for the Doing Motherhood podcast, you have products or services that you would like to see advertised, okay? We'll put what if you got the t-shirt, honey, I'll wear the t-shirt, okay? If you have mugs or things that you want to sit here, that is what we'll do. If you want me to have an ad that I speak out to the folks who are listening, to all the listener friends, y'all let me know. There's a link. There will be a link in the show notes. Click on that link, send me an email, put DMP sponsor in the subject line, and we'll get it going. So until next time, take care of yourselves and take care of each other.